Okay, so infection control and the dental radiographer. This is on chapter 15 of your dental radiography textbook. So let's first go over the learning objectives in this chapter. The objectives are to define the key terms associated with infection control, describe the rationale for infection control, so why do we do it, describe 3 possible routes of disease transmission, describe the conditions that must be present for transmission of the disease to occur, discuss what PPE is, describe the infection control procedures that are necessary before an X-ray procedure, during X-ray exposure, after X-ray exposure, and then all the infection control procedures that are necessary for digital imaging, as well as for film processing. Also discuss film handling in the darkroom with and without barrier envelopes, and discuss film handling without barrier envelopes using the daylight loader of an automatic processor. So dental professionals are at an increased risk for acquiring diseases, infectious diseases that present a significant hazard in the dental environment. And the purpose of this chapter is to present rationale for infection control and to review guidelines from the CDC, describe in detail the step-by-step infection control procedures used in dental imaging. So to understand infection control practices, the dental professional must first understand the purpose for infection control and the terminology that is frequently used in infection control protocols. The use of recommended infection control guidelines can greatly reduce the transmission of infectious diseases. And these are diseases that may be transmitted from patient to dental professional, from dental professional to patient, and from patient to patient. Dental patients and professionals are exposed to a variety of pathogens that are present in the oral and respiratory secretions. So some examples of pathogens that dentists and dental patients could be exposed to are cold and flu viruses, as well as bacteria, CMV, HBV, HCV, HSV1, HSV2, HIV, and tuberculosis. So there are 3 possible routes of disease transmission in the dental environment. These are direct contact with pathogens such as saliva, blood, respiratory secretions, or lesions, indirect contact with contaminated objects or instrument, or direct contact with airborne contaminants present in splatter or aerosols of oral and respiratory fluids. Effective infection control procedures are intended to alter one of these 3 conditions, thereby preventing disease transmission. And this would be a susceptible host, a pathogen with enough infectivity and numbers to cause an infection, and a portal through which the pathogen may enter the host. These are some of the key terms that we'll be discussing. That's antiseptic, asepsis, bloodborne pathogen, what it means to disinfect, a disinfection, an exposure incident, infectious waste, occupational exposure, and then what PPE is. And that's personal protective equipment. Okay, sharps are also another terminology that you will be expected to know, as well as standard precautions. Standard precautions basically means we treat everybody as if they're infected with some type of terrible disease. And then what it means to sterilize an instrument or surface. So guidelines for infection control practices include personal protective equipment, otherwise known as PPE, proper hand washing protocols, the sterilization and disinfection of instruments, and cleaning and disinfection of dental unit and environmental surfaces. So it's the CDC that develops the standards for infection control. And this is to provide infection control practices for dentistry in order to guide infection control practices in dental offices. Some personal protective equipment will include protective clothing. So this will be your scrubs as well as your lab coats. So it should cover all of your skin or all of your limbs. Gloves, masks, and protective eyewear. Hand hygiene is a general term that applies to routine hand washing, antiseptic hand washing, and antiseptic hand rub techniques. Also, the care of your hands is important. So if you have any type of cuts or lesions that are weeping or oozing blood, you'll need to refrain from all direct patient contact until the condition is resolved. So critical instruments, semi-critical instruments, and non-critical instruments are the three categories that instruments in the dental practice can be classified into, depending on the risk of transmitting infection and the need to sterilize the instrument between uses. So intermediate level disinfectants can be used to disinfect heat-sensitive, semi-critical dental instruments. So this would be things that normally would not go into the autoclave, but are still semi-critical in that they don't necessarily go inside of the mouth, but they have been touched by contaminated gloves or saliva or blood. Low-level disinfectants are recommended for general housekeeping purposes like cleaning the floors and the walls. So if you look on page 140 on box 15-1 and 15-2, we'll see some infection control procedures used before, during, and after exposure, as well as some infection control procedures using during processing. The same infection control procedures must be used for each patient without exception. So the operatory should be completely prepared before the patient is brought in. This means that you'll want to prepare the x-ray machine, so turn it on, get your dental chair in a position so that it's comfortable for your patient to climb into. Prepare your work area and make sure that your lead apron is clean and free of any defects such as any tears or cracks. So in order to prepare some of the supplies and equipment, your intraoral films may be inserted and sealed in the plastic barrier envelopes, and this will keep your films from being contaminated, or this will keep your films protected so that you won't cross-contaminate it with anything else in the office. And so this will include also making sure not only your film, but if you're using sensors, as well as your beam alignment device, so your RIN, XCP rings, or any other miscellaneous items like bite wing tabs or bite wing loop holders. Once your patient is brought into the room, you'll want to make sure that you adjust the chair so that it's comfortable for you as an operator to be able to reach your patient and not have to bend over or reach up high. You want to adjust your patient's headrest so that their chin can remain level with the floor. You'll place the lead apron on top of them and then get any miscellaneous objects prepared. So what I mean by miscellaneous objects are, okay, so miscellaneous objects is going to be like any earrings or any piercings that the patient has. So you'll want to get those out of your patient's mouth. Any miscellaneous objects may interfere with exposure and they should be removed by the patient. So preparation is important for both infection control and time savings. So these will include making sure that your hands are washed, making sure that you have gloves, mask, and eyewear in the operating room, and also making sure that your beam alignment devices are not only clean, but they're available and ready for use. So infection control procedures used during exposure will include drying your exposed receptors with a paper towel, so making sure that we're not spreading too much saliva everywhere, and collecting your exposed receptor into a paper cup or something that you can use to keep it away from anything else that will cross-contaminate. Your beam alignment devices should be placed into the proper receptacles for instruments to be processed and sterilized. And you want to avoid interruptions during exposure. So if you need to go grab something, causes you to leave the operatory, there's a risk of you cross-contaminating other surfaces with your patient's blood or saliva. The best way that the dental radiographer can minimize contamination is to touch as few surfaces as possible. Immediately after the completion of receptor exposures, all contaminated items must be discarded. And this will include getting rid of your beam alignment devices. Don't discard those, but place them in the correct receptacle. Wash your hands, and then make sure the lead apron is removed and cleaned appropriately, as well as all the surfaces in that room that'll need to be disinfected. Anything that your patient touched or anything that you touched while you were in your patient's mouth needs to be disinfected. Neither wired sensors nor phosphor plates can be placed into an autoclave or submerged into a disinfecting solution. So we'll want to wipe those with some type of, use some type of wipe, never a spray on these type of sensors. And then once dry, the plates or sensors are placed into new barrier covers. So we sort of know what wired sensors are. Phosphor sensors are sort of like a hybrid type of or a hybrid technique used before digital sensors were completely developed. So what they were sort of like a film, a normal film that's placed inside of a barrier cover, and it's exposed the same way a film is exposed, except instead of processing the film, the phosphor plates were inserted into a digital scanner, and the digital scanner would process the image and turn it into a digital image on the screen. So now that we have wired sensors that are more affordable and the technology is a lot better, phosphor sensors are kind of obsolete. And although there are some offices that still use them, they are very far and few between. So just something I want to touch on really quick. After you leave your x-ray room or operatory, after leaving it contaminated, or after you're leaving it, you want to make sure that you clean it. Avoid leaving it contaminated, even if there are plans to come back and clean it up later. The contaminated operatory or x-ray room can be entered by another person unaware of its contaminated status, and that person might then contaminate other areas of the clinic. After exposure of the x-ray films, specific infection control guidelines must be followed while transporting the films to the darkroom, handling them, and processing them. And an empty plastic cup can be used to transport the films to the darkroom, and you can allow the exposed film to drop into the cup without touching it. So film handling in the darkroom includes cross-contamination by touching contaminated film and then touching everything else, all the other equipment in your darkroom. So there are commercially available barrier envelopes to help minimize this. So if you look on procedure 15-1 on page 140, it outlines steps for film handling during processing with and without barrier envelopes. Infection control procedures for processing film without barrier envelopes and automatic film processors equipped with daylight loaders include these steps. So first, you want to place the paper cup and some gloves in the daylight loader compartment. And then you want to place a container with all of your contaminated films next to the cup. Then close the daylight loader lid and press your hands through the opening. Once your hands are in the opening, you want to put on your gloves and take one contaminated film out of the container. So open your film packets as described in procedure 15-1 and allow the film to drop onto the processor film feed slot area. Dispose of film wrappings in their paper cup, and after all film packets have been opened, remove your gloves and place them in the paper cup, and then feed all unwrapped films into the processor. Once your films are loaded into the processor, you will remove your hands from the daylight loader, then immediately wash them. Then lift the daylight loader to remove and discard the cup with the contaminated wrappings and the container that held the contaminated films. You'll want to label your film mount or paper cup or envelope or whatever you have to collect your patient's films with the patient's name, and then use it to collect the processed films. And that's pretty much it with this chapter. If you have any questions, feel free to ask them in class, or of course, never hesitate to send me an email. All right, thanks for listening.